Welcome, everybody. My name is Sharmarke Mohamed, Associate Professor of Chemistry. I'm pleased to be joined today by Dr. Hamdan Hamdan, and he's a student who's a fourth-year medical student in the College of Medicine at Khalifa University, Miss Rayyah Alkhanjari. And today we're going to be talking about multiple sclerosis and the link between multiple sclerosis and diet. But before we start, I'd just like to give a quick plug for our Kust review, the latest issue, which is available in both English and Arabic, titled Growing Greener, looks at agriculture and how we can produce food in a more sustainable manner. So please do get yourself a copy on kustreview.com. So with that, welcome to both of you.
Thank you.
To the KU Pulse podcast. And maybe I'll just begin with Dr. Hamdan. If you maybe just explain how you got interested in neurodegenerative diseases and specifically on MS.
My research is focused on a neurodegenerative disease. I work on multiple sclerosis. I work also on ALS. We have in the lab like several projects. Most of them are on a neurodegenerative disease. Recently, I started working on autism, and we have some novel genes I've been identified recently in autistic kids in UAE. That these genes are neuronal genes mutated, has some impact on the disease and related to the autism. But my lab is and research is mainly focused on a neurodegenerative disease. One of it is the multiple sclerosis.
So thank you for that. So Rayyah, tell us about how you got interested in this topic and your training as a medical doctor. And also maybe for our listeners who are not familiar with MS, tell us more about the disease itself.
Okay. So I met Dr. Hamdan during my second year of medical school, and I was interested to engage into research, and he had a lot of research going on, and he was willing to take students early on. So I approached Dr. Hamdan during my second year, and I worked with him actually with not on MS, on another research, a big area of research that he is expert in, which is septins. It's related to neuroscience. And from there, he introduced me to another paper. So after publishing the first paper, he was like, how about we go and work on this paper, which is MS. It was initially just a paper. So we worked on it. We were just a group of 5 students. So we were investigating different types of diets and how they can affect the development and prognosis of MS. We gave our first draft to Dr. Hamdan, and he shared it to the publisher. And they really liked our paper, and they asked us to expand it into a book.
Wow.
So this is how it all happened.
And that's something you have here
Yeah.
for our audience to see. So so this book started as a paper, as you said.
Yeah.
And then it expanded to how many chapters?
16 chapters.
16 chapters.
Wow.
Yeah.
And I can see a lot of the authors there are students that you've
All
supervised
from the medical
school.
Yeah.
Okay, great.
Majority from P4. They will graduate in 2 months, inshallah.
Okay.
And we have Nadia and Sarah. They are P3.
Okay,
Inshallah, next year, the class of 26.
excellent, excellent. So how long did this take to materialize into a book?
Around 2 years.
Okay,
Yeah.
excellent. And is this something that, I mean, the book is titled Exploring the Effects of Diet on the Development and Prognosis of MS. What led you to write a book on this topic? Is the information not available out there? Is it early stages where you felt you had to put things together in one place? Tell us more about the need for this book itself.
So there are a lot of studies that discuss about diet and MS, but there's no strong evidence that collects all of these diets together. So that's why we decided to expand it into a book.
Excellent, excellent.
We had a lot of research. My research was mainly focused how to regulate the human myelin genes and how to come out with the gene therapy. You know, the multiple sclerosis is a chronic
Yeah.
autoimmune disease where the myelin sheath that wrapping the axon is get degenerated and attacked by your own immune system. And one of the studies I published that actually how to enhance the myelination by boosting the gene expression for these myelin genes. We did a lot of molecular mechanistic pathway working on this one. So moving to the diet, if you want to think about it, linking the diet and your immune system is very important. And I always tell my students in the class, what you eat, it's define your brain or shape it. It's not the only one, but it's a major factor. So it's affecting whatever what you eat is very important. Even it affects your mood. You know that. Of course, there's other factors like working out, exercises. It's very, very important. But diet is something daily. Everyone, common. And this is the kind of the idea. There's a lot of research actually on animal model. And I think Rayyah, she did very extensive search and very good work on one of her chapters, how to explain animal model and the diet. And since we are in Ramadan, about fasting even.
Yeah.
And how this is actually reduced the pro-inflammatory pathway because MS is, like we said, autoimmune, but the pro-inflammatory pathway is dominated and the T cells and the B cells, when they pass the blood-brain barrier, and then they start attacking the myelin sheath, and which is your own body. This is how we thought about like linking diet and immune system, and of course, eventually, the MS disease. We're not proposing a cure. There's no cure for the MS, but the diet is very important and play a very important role in your lifestyle, in cognitive even function, how healthy the nervous system can develop. Even you can see all when the kids, babies, the infants, they focus their food very expensive. They try to make it highly enriched in very important ingredients to boost their immune system, their nervous system growing and development during their early stage.
So this is very interesting that you mentioned also about fasting, because there's a lot of studies that show that food itself can be a poison if you eat the wrong foods, right? And restricting your diet is sometimes, helps your body kind of recover. So maybe Rayyah, you can tell us something about the kind of foods that we should be avoiding and the kind of foods we should be having more of when it comes to staving off MS and other diseases like that.
Okay, so foods that can promote, that can help reduce inflammation. One very big diet with a lot of research on it is the Mediterranean diet. So this type of diet is rich with fruits, vegetables, legumes, and grains. And it has been shown that it reduces inflammation. So it helps support our immune system, our neuronal health, because it reduces inflammation. Another type of diet as well is the ketogenic diet. It has been shown that it reduces oxidative stress on the nerves. So this diet is a high-fat, high-protein, low-carbs diet. And they did studies, but we still need more research to support that ketogenic diet is actually helpful. Another one, as you both mentioned, is the fasting diet. So there are several types of fasting. One type, intermittent fasting, there has been a study that was done on animal models that showed that, so basically these animal models, they're mimics, so they're mice, in which they mimic multiple sclerosis in them. So they introduced intermittent fasting, and it showed that it reduces the progression of multiple sclerosis. It improves the neuronal health in these mice. It also decreases the severity and the disability when they get a relapse. Another one is focusing on saturated fats, focusing on several vitamins, 3 big vitamins, vitamin D, vitamin B12, and vitamin B9. So vitamin D is very important because it acts as an immunomodulator. So it maintains the balance in our immune system. It can reduces pro-inflammatory markers and increases anti-inflammatory markers. Overall, maintaining the balance, protecting our nervous system. Because at the end, multiple sclerosis is an autoimmune disease. It's your immune system fighting your own body cells. So by maintaining these balance, you can support the immune system.
Great.
We had a whole chapter about vitamin D. It's a very, very important. She was the most important. Like, this is how initiated, actually, from going from paper.
Yeah.
We start talking about vitamin D, and we highlighted a lot about this vitamin. And like she said, it's an immunomodulator. It's very, very important.
Good.
And you can see a lot of patients, they have autoimmune disease, regardless, like Crohn, ulcerative colitis, not only MS. I'm just talking in general, autoimmune disease. They had a history of deficiency and low vitamin D. Vitamin D is very important key player in the immune system. Also, beside vitamin D, the B families, vitamin Bs, like B12. B12 is very important for myelin repair. And B6, B1. So in general, neuronal cells, they love the B families. It's enriched them. And there's a lot of study even for the ALS patients. Some of them, they recommend multivitamin B because they saw some deficiency. Some studies show that.
Yeah.
In ALS patients, I'm mentioning. Of course, there's also, we've mentioned, I think, vitamin A and E. All of these, they are family important to maintain and boost the immune system and the brain function. So immune system and brain function. And this is kind of, it's not outside the topic, but I used to teach them in the GI course, the enteric nervous system. Have you heard of the enteric nervous system?
No.
So enteric nervous system, they call it the second brain.
Right.
And that brain is inside your gut. Okay. So a brain in the gut. So you see, I'll say, I have a gut feeling. This is where it came from.
Okay.
So this ENS, or enteric nervous system, highly complex neuronal system, can function independent from the central nervous system and the peripheral nervous system.
Right.
And that enteric nervous system, or the second brain, or the gut and the brain and the gut, is responsible for many functions. Most important, secreting hormones, the movement of the bowel, like peristaltic movement, neurotransmitter release.
Yeah.
So imagine you have like a highly specialized complex neuronal inside the GI.
Sure.
Can function independent from the CNS and the PNS. And the diet is very important, linked, because that system recognizes the type of food when it reaches the GI.
Sure.
I mean, we're talking like, we're not going to talk anatomy, the stomach or the small intestine.
Sure.
But it's all the way that enteric nervous system.
Sure.
And there's a lot of disease related to that enteric nervous system, and the most one common, irritable bowel syndrome, if you heard about it.
Yep.
So, and there's a lot of unknown the cause of that disease. So really, diet is very, very important. We're not a nutritionist.
Yeah.
We're not talking about it.
Yeah. But one of the things that I found interesting preparing for this podcast is that we tend to think that diseases like this are common people who are old. But MS is a disease of the young, okay? So can you just explain why that is, and
we had this discussion actually.
Some of the statistics surrounding that, which maybe is counterintuitive.
That's a good question. It's very common in the young adult.
Yeah.
And I think one of the reasons for this is, let's say, the immune system is very active at that stage.
Right.
That's one thing. And remember, it's an autoimmune disease. So hyperactivity of the immune system. And at that stage of development, it's very active, the immune system, highly active. Another thing is the hormonal and the sex hormones play very important. Estrogens and testosterone, the sex hormones, play a very key role because they affect the immune system. So it's linked to that one.
Okay.
And that's why kind of very common, and you can find it. We've seen some cases in pediatrics, right? You've seen some cases in the hospital with very young kids.
And even older generation. So all ages can get MS.
Sure.
But statistically, you see most patients within the young age, so between 20 and 40 years old, they're more susceptible. So the evidence is not really clear as to why, but as Dr. Hamdan mentioned, probably it's his thought that maybe it's because of overactivity of the immune system in the younger generation. That's why it's they're more susceptible to the disease.
Now, can I ask you a question? Where would you think the MS will be common? In rich countries or in poor countries, you would think? Because we're talking about diet.
Diet.
I
would say rich countries because they have more food available and
it's more common than MS.
I would guess because of more plentiful food, right?
More plenty food.
Yeah, lots
but
of.
What kind of food? That's the question.
Probably junk food.
Yes, you're right. It's common, and one of the main reason, actually, the poor country, they are highly exposed to the sun. The best source of vitamin D is to get it from the sun. So you can, if you like 15 to 30 minute, like a sun bath, it's a very nice dose of vitamin D.
Sure.
If you cannot, like some families, they cannot afford like the seafood and big source of the vitamin D. So sun is the best one. Another thing you would think about it in rich country, they are very advanced in diagnosis, MRI, and very good neurologist.
Yes.
And other countries like poor one, like they might not have neurologists, they misdiagnose. So this also
that's also
that's another factor. But go back to the food.
Yeah.
The Western diet is rich in what? Highly saturated fat.
Right.
Compared, we are unbiased because in the Middle East,
sure.
the Mediterranean is the best. I mean, this is based on all reviews. Go online.
Yeah.
If you review the restaurants, you go in Abu Dhabi, there's very good Mediterranean food.
Yeah.
I'm not gonna mention any of it, but in general, highly saturated fat. This is a big part. We mentioned that one of the chapters. The healthy diet has high fiber, and high fiber is very important for your GI. So we always go back. It's kind of all linked together. So it's kind of all connected. Your GI system, immune system, nervous system, and of course, the food is the source of the energy for all of these systems, let's say.
So in terms of, you mentioned like advanced medical let's say, equipment can diagnose these things, and if you don't have that, then you're more likely to miss it. What are some of the symptoms associated with MS, in case people...
That's a very good question.
Want to kind of be aware?
So it's a range of symptoms. Most common one, sometimes they would come in and blind in one eye, optic neuritis. It's called optic neuritis, where they come in and there's a damage to the optic nerve, so they get blind into one eye because it affects mainly the brain and the spinal cord. So if you get an insult to a specific area within the brain, or you get an insult to a specific area within the spinal cord, you get a range of focal neurological deficits. There's also another sign where they get numbness, tingling sensation. So it's
a range.
Yeah, it's a range. Yeah.
And I guess it can also be misdiagnosed for other things which have similar symptoms.
There is a specific criteria to diagnose MS. So it has to be disseminated in time and disseminated in space. So you get your MRI of the brain, and you have to see insults in different parts of the brain in different times. And this is where you can say, oh, this patient potentially has multiple sclerosis. So they have to meet this criteria for you to diagnose them. And there are different types of multiple sclerosis. You have the relapsing remitting multiple sclerosis. These patients usually, they come in with a relapse, so a neurological deficits, and then they recover with the right medications. They can recover and they gain full functionality. Then you have the secondary progressive MS. Sometimes people with patients who are initially diagnosed with with relapsing remitting MS, they can progress to secondary progressive MS, which is more disabling, because in secondary progressive MS, there is minimal or no recovery. So they would get the insult, and it will be hard for them to regain prior function. Yeah, and then you have other types that are mostly common in male, which is primary progressive MS, where they get an insult and they never recover. And it's just continuous insult, and you just try to manage the symptoms, but you don't regain the full functionality. Yeah.
Okay. So we were talking earlier about fasting and how this can be beneficial. So maybe you can just tell us a little bit about what sort of foods can maybe inflame the immune system in the context of MS?
What do you think, Rayyah? Which one? We've talked about this many times. What are the types of food? We talk about two pathways in the multiple sclerosis. So we have the highly saturated fat, for example. We had a whole chapter like this talking about some certain types of food like push for the pro-inflammatory pathway. And we're talking about pro-inflammatory pathway, you are like making the immune system very super hyperactive, might have a negative feedback, and then counter back on the myelin, which is causing degeneration for this myelin. On the other side, like highly antioxidant food, like not, I mean, we're unbiased, but if you go to a restaurants, for Mediterranean restaurants, they would add this pomegranate sauce, different roman, you know?
Yeah.
I mean, who will do that?
Yeah.
And pomegranate is like highly antioxidant.
Right.
Okay. We couldn't find a lot of information, but I like to speak about it because I'm a big fan of it. If you know the yerba mate,
Right.
it's very common in South America.
Right.
Have you seen like Messi and
Right.
and all these famous players
yeah.
from Argentina and Brazil? They drink it.
Right.
So it turns out that yerba mate, highly rich in polyphenols, highly antioxidant.
Right.
Okay, and this is very crucial for the body
Right.
and for the immune system. Okay, I mean, I've been drinking it for 30 years maybe every day. I think even my students start drinking it. Kind of effect.
That's why you look so young, I think.
But I couldn't find a lot of good papers, very well studies, because this type of herbs, which considered like a green tea, is only common in certain culture, certain countries.
Right. Would you like to add anything?
Yeah, so regarding what types of food can promote inflammation and increase the susceptibility of developing autoimmune diseases, not only MS. We have, like, as Dr. Hamdan mentioned, foods that have a high amount of saturated fats. High salt diet has been shown, there is a strong evidence that it can promote inflammation of a specific inflammatory marker called Th17, which promotes further inflammation. And also food with ultra-processed food, which is very common in Western culture. So foods with refined sugars, a lot of saturated fats, as I mentioned. Yeah.
And smoking, you want to mention the smoking?
Yes, so smoking is an environmental risk.
Right.
So there is a strong association between smoking and the progression of MS.
Right.
So I mentioned previously about relapsing remitting MS.
Yes.
and how it can transition to the secondary progressive MS. So studies have shown that smoking can make this transition faster.
Right.
Yeah, so people can transition faster from relapsing remittance to secondary progressive.
Okay.
Obesity is also another environmental factor because it increases inflammation. For example, leptin, which is in our fat tissues, it has been associated with promoting inflammation. So these are all, it's a collection of
It's a collection of things, yeah.
that play a role with developing this disease.
So, and I guess just to finish on for you, you got interested in neurology because of this kind of work you've done and many of the unsolved
Not because
problems.
of me.
And I'm sure Dr. Hamdan's influence as well on that. Mainly because of him. So tell us about your kind of trajectory and what kind of work you want to do in the future.
I'm actually, so I'm interested in resuming my clinical studies, so going for residency, hopefully after medical school. I'm also interested in integrating research with medicine because I feel like, okay, it's good to see patients every day, but the impact that research has is much more prominent. Like you can impact a lot of people with research. So that's why I want to still be engaged in research. So combining research and clinical work, hopefully.
Excellent.
Yeah.
Excellent. Well, thank you very much to both of you,
Thank
for coming to the podcast and having engaging conversation.
Thank you so much.
And I think we'll stop here.